Good day and welcome to the Seeds of Synergy podcast. My name is Patrick and it is a pleasure to have you journeying with us today. In this conversation, I'm talking with Julia, my aunt from South Africa, who is a palliative care doctor. She runs her own NGO, which is called Umduduzi Hospice Care for Children, which looks at taking care and providing essential support for children that are battling with terminal illnesses. In this conversation, we discuss her own journey in medicine, how she ended up in palliative care, as well as some of her own lived experience, pearls of wisdom to share. She is a remarkable person, and it is an absolute privilege to be able to share this conversation with you. And I hope as a result, you either learn something new about palliative care, or there's some other seeds that are planted in your garden. All the best, and I hope you enjoy. So, I'm joined today with Julia Ambler, my lovely aunt from South Africa. Thank you for joining us.
Patrick, it's really good to be here and so lovely to be part of this conversation with you.
Perfect. I was scouring through my contacts and I was thinking about who I know, not to say that everyone in my contacts doesn't have something valuable to share, but who I know that is doing something really, really positive, both for their local community and for their wider community. And your name was definitely one of the first that came to mind. Do you mind maybe explaining a little bit about the work that you do?
No problem at all. So I'm a doctor, a medical doctor, but I've spent the last 20 years working in a field called pediatric palliative care, which is really care that promotes quality of life and symptom control management for kids that have got very serious illness. So that might be something like cancer, it might be a congenital problem that a baby's born with. The conditions that we see generally, the lifespan will be shortened. Not always, but there is a risk of that. And so those families and that child need a lot of support during their journey, whatever their journey looks like. So palliative care is all about providing that care to these kids and, of course, to their families and their siblings who are often forgotten.
Wow. And did you start your medical profession with the idea of palliative care in mind, or did you just start a medical degree and one thing led to another and that's how things turned out?
Yeah, so I mean, it is a long story, which I won't bore you with. But when I started my med school journey, I really thought I'd probably be a surgeon, which is quite funny when I look back, because that's really not what I would want at all. And I think, palliative care wasn't even part of my undergraduate training. We didn't know anything about it. It wasn't a thing. But when I graduated in 1999, it was the height of the HIV era in South Africa. There were no ARVs, so no medication to control the HIV, and patients were sick and they were dying, and it was a disaster. And me, as this brand new doctor going to save lives, found that I actually wasn't saving any lives at all. And I was signing more death certificates than I ever thought possible. And those patients didn't have a good death. They weren't cared for, they weren't supported. I did what I could in my capacity, but I didn't really know what I was doing. So I always felt that I'd let those patients down. So when I had the opportunity to travel to the UK and work there for a number of years, I came across this concept and it's like, wow, there's a whole field that does this. And that's when I really became interested and did my diploma there. And I worked at a children's hospice part-time for about 6 years while I was in the UK.
Wow.
So then I came home and needed to find something to do because it didn't exist here. So I had to start from the beginning again.
So palliative care was an existing branch of the medical field in the UK, but nothing on that similar sort of level existed in South Africa.
Nothing at all. We have had, I think since the early 70s, we've had a few hospices,
Yeah.
which were effectively providing palliative care for the dying. But it was really all about the dying patient at that point, rather than recognizing it as a medical specialty that can help from early on in the course of an illness. And so that it was really a very few pockets of people providing specific end of life, sort of last 6 months of life care to patients with very serious illnesses, mainly cancer at that time.
Yeah.
So it was a new field, and it's really taken a long time to get the buy-in from people in the community. And still in South Africa, almost all palliative care services exist within the non-profit sector. We don't
Wow.
have a medical specialty here that you can train as yet. It's coming. We're working very hard on that. But at the moment, it's a path you choose if you want to, and then you go and work out how you're going to study and where you're going to work and where you're going to get your salary from at the end of the day. So most of it still
Wow.
is in the NGO sector. Yeah.
Wow. And just to reiterate, so the palliative care work that you specialize in is with pediatrics, so children, what sort of age range would that be?
We literally start at 0 and go up to 18. So
Wow.
any if yeah, you're a child across that. It is very broad because obviously the diseases of the newborn are quite different to the diseases that teenagers get.
Yeah.
And the way you have to approach them is also quite different. You don't speak to a pregnant mum the same way that you would to a teenager with a cancer. So it's very varied and diverse, but I love it. I get to meet all sorts of characters over my career. Um, yeah, so we also recently have started looking at antenatal palliative care. So the mums who are pregnant that get an antenatal diagnosis of something horrible of
What
the
is an
fetus, then
antenatal diagnosis? Sorry.
so when you are still pregnant and
Yep.
you go for a scan, and then the baby is diagnosed with something really, life-threatening, such as a brain malformation or a big
Wow.
heart problem that might not be operable. So then those moms carry those babies knowing that the child might have a very short life after birth if they actually make it to the end of their pregnancy. So they also need a lot of support. So that's a very new and exciting kind of part of our job that we kind of looking to expand into. So when we're talking children, we're talking mainly 0, but also maybe before they're born as well. We kind of trying to get into that because it's just so important.
Yeah.
And if you think about the baby that gets born with a big problem, like it's quite late to start the management, the palliative management then after they're born. Whereas if we'd known, we could have done it before
Yep.
and started with the mom and with the support and making decisions, that kind of thing.
So obviously from the medical side of that, it carries with it all its own considerations for how to keep the patient comfortable and in a good place whilst they're dealing with whatever illness or sickness that they're dealing with. But you mentioned before the support work and the sort of engagement with the family and the patient itself is probably equally as important in your line of work.
Yeah. I mean, I think even when you're dealing in adult palliative care, if my sister was sick, I would need some support. But I think when it's your child that is sick, it's just really rough. And that impact on having a sick child in the family affects the marriage. It affects the grandparents. It affects the siblings of the sick child. So there's a lot of psychological and emotional and social support that these families require. It's also really expensive to have a sick kid.
Yeah.
And a lot of the treatments in South Africa in our state system are actually free for kids, which is great.
Yeah.
But you've still got to get to the hospital. You've still got to, fund other things that maybe aren't paid for by the government. So it's very challenging on families. And also, if you're looking after a child that's very sick, you can't go to work.
Yeah.
So you are now lacking your income, and you've got to support a child who is very sick. So these families do, sure, the problems are, you can just imagine the knock-on effect that a sick child has in the whole system.
Wow. And in terms of your own training, how have you sort of been able to foster those skills to be able to support the patients and the family through what I can only imagine is a horrendous time in their lives?
Yeah, it is. I think I was very lucky to spend that time in the UK where it was an established field.
Yeah.
And my trainer, I worked under a GP who was working part-time GP work, part-time children's hospice work. And he was just the most phenomenal man. And he said things to me very early on in my career, like, just get used to good enough is actually good enough.
Yeah.
And because I think a lot of doctors and probably engineers too have A-type personalities where they're expecting perfection, and
Yeah.
that puts a lot of pressure on everybody, and no good really comes from it. So that was one of the things he said to me is being good enough is good enough. And then he made me question everything, why we do things a certain way, why, and I think just kind of learning to adopt a more curious approach to the way we practice medicine, and then also to our patients and asking them what matters to them early on in my career really made a big difference, because that is my approach. So when I see a patient, I and their family, I believe that I provide what is called patient-centered care. I think about them, not the illness, not the
Yeah.
disease, but really think about what it is that they're going through and how do we support that. So not trying to make them fit into my model of medicine, but me trying to fit into what matters to them as a family. And I think having that approach from early on really has helped. And then obviously just constantly learning, attending courses, self-reflection. Not something that all of us are very good at. But one
No.
thing also he did teach me was to, after a consultation, if you didn't feel it went that well, or if it did go well, like think about, well, what made that good or bad? And then try and remedy or continue, depending on what you find.
Okay. So you mentioned self-reflection there, and I wanted to actually draw upon this. I can only imagine for the families themselves is a incredibly, incredibly huge thing for them to process. But for someone like yourself and the team that you work with who are interacting with these families and these patients on a day in, day out sort of basis, how do you sort of manage your own mental well-being and take care of your own, yeah, emotional faculties so that you're able to provide the best care that you can?
Yeah, look, it's such a big question, Patrick. But it's a good question, and I think all health providers should be focusing a little bit more on this. I think we saw with COVID just how bad the burnout and moral distress is amongst health providers, and there are different strategies to looking after oneself. And I think I've done a lot of reading in this area because we do run an organization where we've got nurses and social workers with us, and I think I'm quite hardened now. Not completely. I think I'm still a very compassionate person, but I would like to say that I think I'm used to it. There's some cases that rock me, but most of the time I can behave like a professional. And I think that's because I've been doing it a very long time. But when we've got new staff coming in, they don't necessarily know how. So I think the first thing is that there has to be institutional care as well. It needs to be an environment that promotes resilience of your staff. So, and I do think that that is a very important factor. So we, for example, at least once a year, we'll have a get together where we get in an external facilitator and have some kind of self-care activity, where we taught some skills, whether it be, a mindfulness skill or releasing energy kind of thing, or journaling, whatever it is. We've kind of bring in an external facilitator. Our next one is actually coming up on the 11th of April, and I'm really excited because the staff we've had a rough year. We've had a lot of deaths. And so we do need that time. So I think on an institutional and organizational level, we are trying to make sure that we're all cared for, and we're very open and honest with each other. And there's a lot of space for debriefing about how we are feeling. But on a personal level, gosh, that has been an epic journey of trying to work out what works and what doesn't work. And I think one of the things that has helped me as well is recognizing the difference between sympathy and empathy. What out of my reading and my reflections, sympathy is really when you feel sorry for someone, and it doesn't help. Feeling sorry for someone creates a power gradient. So I am then better than you because you're worse than me, therefore I feel sorry for you.
Yeah.
And then the inclination is to do stuff for people instead of with them. So if I'm feeling sad for you, then I need to now make it better for you. And that's quite disempowering. So, and as a doctor, if you do that, it comes from a good place, but you end up trying to fix people and their problems rather than actually just being there with them on their journey. So empathy and compassion is far more about just recognizing where somebody's at. So sitting with someone and saying, gosh, I can see what you're going through is really hard. I'm not sorry for you. I'm not going to try and fix it, but I can walk next to you during this path and it's an empowering relationship that you then have with this individual that is needing your assistance. And then compassion is really taking that empathy, the recognition of someone else's suffering, and desiring to do something about it. So asking them, how do I support you? How do we get this better together? How do we facilitate something to make you more resilient, to make you better able to cope? And I think having those in my mind quite clear, I know when I'm starting to go err on the side of sympathy, because I start feeling it's a horrible feeling. It's, when you're feeling really sorry for someone. And immediately if I recognize that feeling, I kind of go, okay, that's not going to help here. I'm going to start doing stuff for the patient instead of working with the family. Um, so I mean, I don't know if that does make sense, but
No,
that
no,
really
it
has
does.
helped me.
Wow.
Yeah.
So coming back to that, so empathy and sympathy sort of distinction, do you have maybe an example or a story that you might like to share about a family that you've walked with and journeyed with?
A million stories. um, so let me think. I think one of the difficulties in our job is boundaries, and I will say openly that I have very few. I've got a lot of patients that are friends on Facebook, which is probably an absolute no-no. But it's really hard when you use part of their lives at such an intimate time. You really get to hear their worst fears and their managing their really terrible pain. You're hearing all of this, and it's very hard not to kind of move almost into a friendship relationship with patients. And obviously we don't do it it doesn't happen with every patient, because what people want from us are different things. But, for example, I've lost a young man last year. He was 16 when he passed away. He was born with Down syndrome and a few other abnormalities, congenital problems. But one of the biggest ones was his heart. And unfortunately, by the time it was realized that he had this problem, it was too late for them to be able to fix it. So it took a long time. He lived with that heart problem for the 16 years. And when I met him, he was about 6 and an absolute character, um, cheeky as. But he was asymptomatic at that time. He was bound to a wheelchair because he had a physical disability as well, and we I had very little to do with them. The mom kind of said to me, "Nah, we're fine, we're fine, we're fine." And then at about, I think, 13 years of age, he started to get really sick. He was getting increasingly blue, lack of oxygen. And that was when my journey with him really began. And mom kind of said to me, everything you said would happen is happening now. Can you help? And so we just started that relationship. So I'd see him either at the hospital. If he couldn't come to hospital, I would see him at his own home. And then you get to know the family quite well. He's got a little sister who has really changed in the time that I've known her. She was a newborn, and now she's, grade 4 or 5. Quite a difference. So I've had to kind of look at that. And so really getting to know both parents, getting to know the child very well, and ultimately his symptoms just got worse and worse and worse, and eventually he passed away last year. And that family, we've maintained contact. I've met the parents' siblings, and I've met the grandparent. And actually, in the meantime, then I've assisted the granny when she was diagnosed with cancer, and she also passed away last year. So the relationship just goes on and on. Now one of the aunties has cancer, and they've asked for some support there, and I'm more than willing to do that, because these are people that I've known for a long time. And it's just, I think, for them to have someone that they can actually trust, and I will always give an honest opinion. So the little girl, the sister, has been getting support from our social worker because she really struggled at first. Mom and dad have been seeing the social worker as well for grief and bereavement support. I've maintained contact with them, and I think that it was hard for me when he was sick, because his physical symptoms were very difficult to manage. And so he had extreme pain that I did struggle with. Luckily, we've got quite a broad palliative care community across the country and internationally. So got lots of advice about what to do, what to try. But I think for the family, just knowing that there's someone at the end of a WhatsApp, I can reach out, I can phone anytime and get some kind of support or guidance or advice. Because I think that for parents, just not knowing what to do, not knowing what's going to happen next, and having someone that can kind of not know exactly, but has some experience and can be able to say, well, this is what we should be expecting now. This is what's going to happen next. So I don't know if that sort of illustrates the journey a little bit.
No, 100%. Meeting a young boy at the age of 6 and then at the age of 13, symptoms progressing and having had that connection with obviously the mom and the son and the daughter up until that point, I can imagine how invested you would have been in that family and how they would have been much more than just a patient-doctor relationship.
I think that's a huge privilege, to have that. And I often feel sorry for doctors that are hospital based. I'm sure they don't feel sorry for themselves, but I feel it is an enormous privilege to be able to see where someone is actually coming from, where they're living, what is um, the cultural, religious, spiritual aspect of the care that is needed. And you don't get that in a hospital appointment unless you specifically ask, which in palliative care we do. In traditional sort of Western medicine, we don't worry about the spiritual side at all, but it's essential. You can't cut people off from what they believe and what is, in fact, the essence of themselves.
Well, that ties in actually really nicely to what my next question was going to ask you, centered around your sort of whole perspective around death and spirituality and religion. How has your outlook on that changed, or what might it look like now as a result of your constant engagement with death and all these different religions and spiritual outlooks that you're exposed to in your line of work?
So I don't know that my stuff has changed that much. I think probably having two atheist children has been more challenging than anything else in my career. No, I joke. So I think that what being in palliative care has really taught me is just the value of everyone's spirituality, and that everybody is spiritual, even if they're a diehard atheist or whatever they claim to be. We all have that spiritual side, that sort of essence of our being, the things that matter to us most, whether it's nature or a religion. And the beauty of being in a country like South Africa is we are just surrounded by really multicultural. And within each culture, there's differences. You can't just say, oh, they're Christian and that's it. Um, so we've been very open to, so I suppose I've gotten more open to just listening and hearing what matters to people. I do find that people with some kind of faith in a greater being uh, have an easier time at the end of life. I think if there's a connection to something else, it does help. It doesn't make it easy, but it
Mm.
certainly does. I think when people are suffering, they need to make meaning of the suffering, and suffering with no kind of end or kind of reasoning or meaning is very, very hard to manage and can result in complicated grief, which is grief that, manifests in, very complex ways. And it's difficult to manage those patients or those parents. Not that grief ever goes away, not that you ever get over the loss, but I think if there is a connection to something else greater than yourself, even if we don't understand it, that does make it more bearable for families. So that's certainly one thing I've seen. And I know that it is so different for every family, and just respecting that and asking the questions, because patients are not used to being asked, because no one cares, right? I'm here to fix your disease, not think about what you think about your disease.
No.
But if I always explain to my patients why I'm asking them what they believe, I say, because I know that if you have a faith system, you probably trust it more than you trust me.
Yeah.
And so it would help me to know what it is that you're thinking. I mean, a recent case example that we've had is a young woman who, is a Zulu woman, who had been called to be a sangoma, because it's a calling. It's not something you just wake up and decide I'm going to do. The spirits kind of speak to you, the ancestors speak to you, and then you need to go and do your training. So off she went and did this training, but actually didn't really like it. And she's very modern and she's fashionable and she's beautiful and she wanted to earn money, and so turned away from that. And this is all her kind of words, and started, working in a call center and just, being more Western and forgetting about her ancestral roots. And then she had a baby that was born with a very complicated heart problem that required heart surgery. That child, is in ICU as we speak, and we don't know what the outcome will be. And one of the things she has shared with us is that she feels that this is a punishment
Yeah.
because she left the calling and ignored it and to focus on other things. And that's been enormously painful for her because it's almost like she did this to herself and to her baby because she made bad choices. And that, so we can't fix that problem. And that's the thing about palliative care. It's not there to fix it, but her being allowed to express it, being allowed to talk about it without judgment, without fear that we're going to, have an opinion on it.
Yeah.
We can then say, well, what do you think would help? And she did go home. She had a pass out from the hospital. She went home, spent some time with her family, went and did some rituals that were really important to her. And she's come back in a much better headspace, better able to cope with her baby. And if we hadn't asked those things, we probably wouldn't have kind of offered her to go home. We wouldn't have had those conversations about what's going to help that situation. And we would have focused only on this baby. And she'd be sitting there super stressed. And then if something does happen to the baby, if the baby doesn't do well, she's got more blame and guilt because she didn't address it.
Yeah.
So we can say to someone that a congenital heart problem is definitely not linked to spiritual things if you believe that. But if the patient doesn't believe that, it doesn't matter what you say,
Yeah.
they're going to go away knowing what they know. And so that I think it helps for us to understand what it is that they're thinking and believing so we can support their journey in that, because it's not there, I'm not there to tell them anything, I'm there just
No.
to walk the journey, right?
And I think that is such a good point to mention. And obviously, journeying with a lot of these patients, having exposure to lots of different outlooks on life and lots of different ways that people interact, I imagine that's really honed in your ability to just listen and be there for someone. No one wants to be told what to do. And even if you did tell them what to do, if it doesn't line up with what they think or what they believe, it really is in one ear and out the other. So that's amazing. In terms of callings, do you feel as if you had a calling to work in the palliative care sector? It's definitely not the biggest money spinner in the medical profession.
You're telling me. Yeah, so I definitely a calling. My sister and I chat about this a lot because I think I don't believe that everybody has to have a calling, and I don't think you have to work in your passion. I think I was really lucky that I found something that I do believe I was meant to do. And I think that also helps with my self-care and my self-reflection that I know that I'm doing the right thing. Every day I wake up thinking, oh, this is hard. I don't feel like doing this, or I know this is what I'm meant to be doing. And I do think that's why we've managed to run this NGO quite successfully over the last 12 years. It's financially a nightmare fundraising all the time, but I think when you are doing the right thing for the right reason, um, eventually things will align. And I do believe it's a calling. The way it came about that I got into palliative care is in the UK, when you train there as a GP, you have to do 2 years in hospital, rotating through different specialties, and then 1 year in a GP practice as a registrar under somebody's wing training.
Yeah.
And I was doing pediatrics at the time. And one of my senior doctors came to me and said, there's a registrar post going that I think you'd be perfect for. I hardly knew this woman. But she was adamant. And I said, well, actually, I've already got a nice number lined up. Thank you. I'm okay. She said, just apply, just apply. So, yeah. Anyway, 2 weeks go by and she comes back. She says, you haven't applied yet. I said, well, no, I've already committed elsewhere. I'm should just go and meet them. So I did, and I was sold immediately. I met this guy, Justin Emery, the most amazing man,
This was your
and
mentor?
just my mentor. Yeah,
Yeah.
changed my whole life direction really. And I was sold on the idea, and that's how I got into palliative care. So it does feel like there was a push, and there was a door that opened and I walked through it. Um, and then when I got back to South Africa in 2008, there was no pediatric palliative care services anywhere, but there was a woman in Joburg who was wanting to start. palliative care services, and had done a little bit of work in Johannesburg. And she had actually written a textbook with my mentor around pediatric palliative care. So
Oh,
he thought, on the off chance that we could be friends, let me just introduce you. You both have kids. You're both, interested in peds. You're both interested in palliative care. And she said, "Well, do you want a job?" They had actually already had started the process of opening a Durban branch of this organization, and I literally walked in as their doctor. So we got back in the January, and I was working with them by July, August. So yeah,
wow. Wow. And again, coming back to what we were talking about, I think you can believe whatever you want to believe, but from my perspective and my lens, I would say that I think 100% those were definitely callings. The fact that someone that you barely knew from a stranger was following up with you and very adamant that you meet this person, it seems to be
yeah.
a little bit more than a coincidence, in my opinion. But again, each their own.
Yeah, I mean, it could be all coincidence, but at the same time, doesn't matter.
No,
I think if you've got, and I think that's with your inner voice is so important, your instinct. And,
intuition,
and yeah, as doctors, we train in that because a lot of the time you're operating, not physically operating, but you're working with not enough information, making educated guesses, taking risks about diagnoses, but a lot of it is based on your intuition. It can't all be on hard and fast tests. When you're working in a rural hospital, you just don't have access to CT scanners and echocardiograms and other fancy machinery. You have to make use of your clinical skills, and the secret of taking a really good history from the patient and kind of putting it all together, but often it is your intuition or your instincts that you have to follow, because you don't always have all the facts. So I think that also is great from a doctor perspective. I'm sure other careers use it too, but just from a personal point of view, that's something that I've gotten used to, listening to my inner voice saying, "I'm really worried about this patient. Yeah, this one's not going to go well," even though on the surface of a thing it may not look that way.
yeah,
And I think that in our work, it's also the looking at the families, what they're not saying. So when you're interviewing someone around, what's happening in the home, and you watch their body language and their facial expression, and listen for the unsaid things as well as things that are said. Because invariably in families, the illness of the child is one thing, but there's usually a lot more going on. And it's so important for us to understand where is the support structure for this family? What are the
yeah.
relationships like? If there is no support structure or relationship, that is a family we have to work a lot harder with than someone who's got a great family and a great community and tons of friends. And, so it's kind of really listening to those things. And that also comes back to instinct and just hearing what is said and unsaid.
Oh, I actually wanted to touch on that a bit more. I believe everyone, I think it's human nature to have intuition and that sort of gut feeling sometimes when either something's not sitting right, people might call it butterflies, whatever you call it. How have you sort of over the years and practice been able to hone in your intuition and trust it a lot more? Because I know a lot of people, myself speaking mostly, I'll have an inner voice or something that's telling me maybe this isn't the right thing to do. And sometimes I don't trust it and I do it anyway, and things don't end up panning out very well. How have you over the years really honed in and listened to that inner voice or that intuition?
I think being so that from the doctor side, kind of that had to happen. So I was quite lucky in that my profession lends itself to that, where you are trusting your instincts in a what seems like quite a safe place. You work,
Yeah,
I'm trusting my instincts at work. I'm very lucky that I'm not an anxious person. I really don't suffer with anxiety, which is, it's a real gift, I would say, because I think anxiety leads to questioning
yeah,
yourself much more and ruminating and worrying about things that haven't happened yet.
yeah.
And I've never been prone to that. So I think that's also just in my favor, that, if I feel something, I don't sort of sit and worry about it. I decide, am I walking through the door? I'm not walking through the door.
Yeah.
And I also just, I kind of think, that advice I had about perfection is not required
Yeah.
early in my career. And just, if you make a mistake, you can go back. There are very few mistakes, that you can't come back from. I mean, obviously, if a patient dies in your care when they're not meant to
That's
have
yeah.
palliative care, that's a mistake you can't come back from if it was your fault. But really, there are very, very few things that you can't come back from. You make the wrong career choice, you take the wrong course. If it doesn't work for you, you can change it. And I think that is, the flexibility and the agility that we have as human beings. We need to capitalize on that and say, in the greater scheme of things, it doesn't matter. So I
No.
think what I've really worked on is my perspective and trying to keep things in perspective. My
Yeah.
mum was always great at saying, don't sweat the small stuff. Um, and I think that it comes from a book that by the same title. And
Yeah.
it's true, don't worry about the little things because it actually doesn't matter. It
Yeah.
really doesn't matter what mark you got, what grade you got. If you really want to do a course and you need a better grade, you can repeat that course. You can go back and get a better grade. Nothing, there is nothing that is too much or too hard. If it's meant to be, you can make it work. So I think just kind of keeping things in perspective. And I do think that mindfulness and meditation help. I don't meditate often enough. It's a newish practice for me. I mean, I've been trying for years, but I've been getting more serious about it over time, and I think that also helps. Is just allowing time and space for something to sit
Yep.
and not acting immediately, which is hard. I'm a doer. I
Same
don't
here.
procrastinate.
Yep.
Never procrastinate. Get on with it. Do it immediately. But obviously, there's a difference between procrastinating and finding time to sit with something
Yep.
before you act upon it. And that is still a work in progress.
That's
Haven't
very
quite got that
reassuring to
right yet.
hear. It's very reassuring to hear. I think no one ever gets there. To be honest, it's
Oh,
a lifelong journey.
it really is. But that's the fun of it, right? I mean, you've got
Yeah.
to you can't, we can't all have arrived somewhere. Imagine how awful we'd be if we were just all feeling like we'd arrived somewhere. So,
Where do we go next? Yeah, exactly. But I think that that's such a good point. I mean, whether it's meditation or whether it is just sitting alone in nature, whatever it might be, being able to take some time to really just sit with whatever it is that you're processing or trying to think through. And like
mm,
you mentioned as well, being able to maybe take a step back from what it is that you're so engrossed in. Because I know from my perspective, and I'm sure your boys' perspective, being very big overachievers, when you're in the thick of high school or university or whatever it might be, the grades or the thing that you're working on today seems like if it doesn't go well, it's the be all or end all. But the reality of our society now is that really the only mistakes that you make are the ones you don't learn from. So
yeah, yeah,
try everything, put yourself out there and don't sweat the small stuff, exactly like you said.
yeah, yeah. No panicking allowed.
No panicking allowed. But again, it's still a work in progress. Yeah.
Oh, definitely, definitely. Um, yeah, when it comes to running our NGO, because I don't panic, and I got a very sort of open attitude. Let's do this. Let's do that. Let's start this. And my partner Tracy is the one who has to go. Jules, I think, can we just one step at a time, please? Can we just have? And that's also quite useful, is to have people around you that know your faults and your weaknesses as well as your strengths and
Yep.
can help you kind of develop them as you go.
And sometimes
Because
ground you as well when you might be a little bit, yeah, detached or
they're all
thinking a
out
bit.
there.
Yeah. Yes. Actually, could we speak a little bit about your NGO? The hope would be that I can potentially get some publicity out there for the work that you guys are doing. It's Umduduzi.
Yeah. So it's the full name is Umduduzi Hospice Care for Children. And the reason we've used the term hospice in there is that people do kind of understand what that means, and that it means serious illness. And the kind of care that we provide is the kind of care that you might get through a hospice. So we don't actually have our own facility. We work within the state hospitals, and we have an agreement with our Department of Health to be able to do that. And the word Umduduzi comes from the isiZulu word meaning the comforter. And when we were looking for a name for our new organization back in 2013, we like trying to kind of find a word that would speak to people. I was at a coffee shop with Tracy, and I said to the waitress, I've heard this word. What does it mean? Umduduzi. She said, you know, when you're not feeling well and someone makes you feel better. And she hugged herself. And I thought, that's our word. That is our word. So, yeah, so that's how we got our name. And the idea is that's what we do. So we're a small NGO. We are one doctor, hopefully going to be two soon, but it's still in the pipeline of funding dependent. We have four part-time nurses, a translator, two social workers, and also part-time, and an administrator. And then obviously Tracy is a social worker, but doubles up as the director of the organization. So everybody's
Wow.
multitasking. So that's the staff. We also have a play program that we run at one of our very busy hospitals because we believe that play is an integral part of healing. And when you're sitting in hospital and bored, your pain and suffering is much worse. So she's been with us for ages. Normandla runs a little play spot called Sitandeni, which means we love them. And that's actually within one of our very busy hospitals in quite an underserviced part of the south of the city. So, yeah, that's the full team. We
Wow.
see kids in all the different hospitals in our city, which is eThekwini City. But because we're working at our main central quaternary hospital, we also see kids from the whole province. So every year we probably get about 400 new referrals,
Wow.
and we have about 200 deaths every year on average.
Wow.
And that sort of number is creeping. Both numbers are creeping. But of course, there are still the kids from the previous years that haven't passed away. Like I told you about my one boy that I knew for the 10 years. So that child and the needs vary. So they're not always, needing a lot of attention. Some families you just check in with them now and again, and the kid's actually doing really well. So that's fine. And it's only when things sort of really get worse that we need to step in more and more. But at least if we develop the relationship early in a course of an illness, we can support the family throughout and be ready for when the needs change, which makes all the difference. So I don't know, is that
Wow.
enough about our organization?
No, well, you mentioned you do fundraisers as well. That's another initiative that I think you said Tracy helps to organize and facilitate.
And we've got an administrator now, also
Okay.
part-time. Everybody works part-time just because we get to pay them less.
Yep.
Yeah, so we recently had a golf day. We literally we've got a swimming race thing that we're part of called Oceans 8 coming up in June. We are opening a charity shop, which is very exciting. And that we hope that will obviously it's going to cost us money to do that, but
Yep.
you have to spend to make, right? So
Yep.
we're really hoping that will become a sustainable income generator for us over the years. And we have all sorts of teas and lunches and wine tastings, and we'll do anything to try and bring in a bit of money. And I think the beauty of being around for 12 years now, with obviously our administration has been good, our audits are clean. So financially, we are trustworthy. People can see where the money's going. We've got a reputation now, and more we're finding that businesses are saying to us, um, well, we need to give to charity, so we get our tax rebate for doing so.
Deductions. Yep.
Yeah. So can we give to you? And that's happened a bit more in the last year or two, which is so nice. Um, yeah. And then we also got something called the 100 Club, which is just really where we say to people, please, if 100 people gave 100 Rand every month, that would make a massive difference. So that has steadily been growing over the years as well.
Yeah, I've heard from my mom obviously that things are going well. There's still hopefully a lot more financials to come through the pipeline, but it's so good to hear that the work that you guys are doing is getting recognized in the community and people are wanting to get involved and support in whatever way they can.
Yeah, it's not a sexy topic, Patrick,
No,
palliative care. It really doesn't, make people want to listen.
no.
But it's incredible how in the country it is growing as a field. And the Department of Health are taking us more seriously, and we've got some big meetings coming up later in the year, and we've got a national conference happening in June that I'm supporting to arrange. And so I do feel it's beyond our little NGO in Durban, in our province, KZN. Nationally speaking, we're doing a lot to try and get it recognized as a specialty, to get it, I teach at the university as well. So it's in the medical students' undergraduate curriculum, which is great. But
Wow.
now we're working on getting it into social work and into nursing so that it really becomes a formalized thing that the national, Department of Health is taking seriously and implementing.
Yeah.
So hopefully going up to Johannesburg in May to write the new national policy with all other sort of stakeholders. So there's a lot going on, and it is really, yeah, it's exciting. So it feels like it's not just Umduduzi and us here in Durban that are sort of making a difference. There are a lot of us nationally now, and there's a groundswell occurring. And yeah, watch this space.
Watch this
Very
space.
exciting times ahead.
How are you finding that your teaching work is being received by the undergraduate medical students? I suppose I can't speak to what undergrad medical school is like, but is it being received well? And
Absolutely, very well. It's a great thing because when you see patients suffering, which you absolutely do, because palliative care is not universal yet. The doctor that sees you will focus on your disease, and so if your heart is failing, for example, they will want to give you medication to manage that specifically, but not think about the pain you might be in from the chest pain or the anxiety or other things. And we
of
come along and
course,
introduce a spot of morphine and a few sort of non-pharmacological ways of managing shortness of breath, and it kind of changes the whole thing. So when young doctors and students see patients suffering and not knowing what to do about it, it's very disabling and incredibly disheartening. Whereas
yeah,
if you now have a set of plans, oh, look what I can do, I can help. And certainly, one of the interesting things for me that I've seen over my career is the increase in interest that emergency medicine doctors have in palliative care. And initially, you kind of think, well, that doesn't make sense, emergency casualty. But that's, the people that go to casualty, other than sort of the trauma accidents and stuff, very often it's patients that have got a severely life-threatening condition like heart failure, like end-stage cancer, like end-stage liver failure. And they're presenting because they're in a state of distress with symptoms that can't be controlled at home. And but actually at the same time, the hospital's not really going to be able to do much.
yeah,
So the casualty doctors are, and it's really become quite common for casualty or emergency medicine specialists to train in palliative care just because it helps them in their job so much.
yeah.
It makes perfect sense after a while. So I think it is being well received. It's an incredibly practical way of supporting people when they're suffering. And who doesn't want to do that, right?
Exactly. And with your teaching, do you weave in your holistic patient-centered approach as a means of how to, yeah, interact and engage with the patient and their families?
Yeah, we teach spiritual assessment, we teach psychological assessment. We really kind of try and get them to view the patient as a whole. And I
Yeah,
teach in family medicine, which is more focused on adult care, and I teach in pediatrics as well. So they're getting it at my medical school, well, not mine, UKZN, they're getting it in two different departments. So I see them a few times over the last 3 years of their degree. And I do think it's making a difference to the younger doctors that are coming out.
just to further that, I wanted to ask if you had any pearls of wisdom or insight that you might want to share with any newly graduated doctors or students of medicine currently from your experience and your interaction with students of medicine. Were there any words that you'd like to impart or anecdotes that you'd like to share?
Yes, many, but I think for me the main thing is that you know as a human being, you have to take responsibility for how you behave or how one behaves. And unfortunately, in our healthcare systems, and I don't think this is a uniquely South African problem, there is that toxic hierarchy of senior doctor versus junior doctor. And there's a real fear, and there's a lot of bullying and a lot of just kind of bad behaviors that are not helpful to patients and actually affect patient safety at the end of the day. Because if you've got a culture of blame and shame when mistakes happen, rather than a culture of openness and honesty where we can all learn from mistakes, patients are going to suffer. And so one of the things that I do try and get the students to think about is, how do we stop it? How do we really just practice better medicine where we're kind to each other, where we're kind to the patients, where we're practicing holistic care? And I think it is actually a decision you have to make every day, because you aren't necessarily going to see that around you. We call it the hidden curriculum, the stuff that you learn from watching others rather than from what you've actually been taught. So we can teach all this stuff, but they're not seeing it. So to not be affected by what you see, you actually have to wake up every day and decide, this is how I'm going to practice. And I'm going to learn to be better, and I'm going to learn how to show empathy, because believe it or not, it's quite difficult to do. The way we train our medical students to ask questions is all about getting to a diagnosis, and it's not actually about listening and about addressing a patient's fears and concerns.
Yeah.
It's all about me getting to a diagnosis. It's a very selfish thing, the way we take a history, and even we call it taking a history. It's quite an aggressive term, I think. I'm going to come from you and I'm going to take what I want from the conversation.
Yeah.
And so I think just trying to get young doctors to just think about the whole patient and to choose how they practice and to improve their communication skills, because at the end of the day, it comes down to being able to communicate well. And we don't know how to do it. We don't come out the womb communicating brilliantly. That's why there's so much divorce and other upsets in the world, because we can't communicate. So recognizing that, owning it, and acquiring the skills. And there's plenty of things you can do to get better at communicating. So yeah, I think that would be my thing, is to just kind of focus on what kind of doctor you want to be and just keep moving towards that goal.
That's amazing. I think just from my own sort of perspective, I think medicine being such a distinguished thing to study post high school, it has very high academic sort of standing. You mentioned to someone that you're a doctor or in the field of medicine, it carries with it some quite a lot of social clout. So maybe that might contribute in some way to that sort of hierarchy that you were describing.
Absolutely. And very big egos.
Big egos, big egos. And yeah, again, coming back to it, I think from my very small engagement in the engineering field, I've found that that is also something that a lot of engineers sort of grapple with. Having established yourself as someone who can think to a certain degree doesn't entitle you to think that you're better than someone else or to treat someone as less than. Actually, I'd argue it's more of a platform to you to be better than that, and to use your intellect and use your ability to understand and interpret things, to communicate effectively, but also to listen and understand, and instead of bringing ego into these things where there shouldn't actually be any ego, to appreciate the value that everyone has to contribute. And yeah, I really hope that going forward it is something that we can move away from the hierarchy and the social status involved with a lot of these degrees. At the end of the day, doctors are doing an incredible job. Doctors, nurses, teachers, engineers, lawyers, everyone is contributing in some way to society. So I think that that's also a very good point, to not get lost in that whole hierarchy of authority and ego.
I know. I mean, when you think about it, if there are no patients, you don't have a job as a doctor. You are useless without the patient. So to be rude to your patient or not listen to them or respect them, and we see it a lot in the private sector as well. We have a very two-tier system in South Africa, where we've got a lot of 80% of our population use a state health system, 20% have private insurance, and the hospital facilities are beautiful. It's all very hotel-like. But even there, where you're paying for your private healthcare, the communication is poor. Patients get treated very rudely, not by everybody, but it's common. And it's nonsensical to me because without the patient, you just literally are nothing. You don't have a job. And trying to keep that in mind, just come back to that at the end of the day. It's all about the patient. That's why you did medicine, you know.
Yeah.
It really comes back to this other human being that you're practicing for.
Something else I wanted to touch on, and it might be a bit left of field of what we're currently talking about, but you mentioned before how one of the aspects you do with Umduduzi is the play, getting the children out of that sort of hospital environment and in an environment where they are having fun and having some form of social engagement outside of focusing on what they're dealing with and processing. Alternative to Western medicine, what other natural remedies or ways about going through life have you found can actually elicit sort of positive mental and physical well-being?
There's nothing I won't try. So, so I think what is interesting is that most of our patients have tried something else before they come to a Western medicine facility, whether it be their ancestors or a traditional healer or acupuncture, reflexology. You know, there's so much available to us now. Unfortunately, it all costs money,
Yep.
which is the limiting factor. But there is so much available to us now, and also around nutrition and diet. I think we learning more about gut health and how important that is and how it affects everything. So I think that there's just so much available to us. On my own personal journey, I've used a mixture of so I've got a nutritionist friend who I get a lot of advice from for free, which is great.
Awesome.
And then I've been to had sort of traditional talk therapy to, you know, when I lost my mom, and you know, my childhood was not bad, but there were some tricky times. So, you know, just realizing that there's stuff from long ago that I've never managed or never dealt with, and just gently working through. And so that was talk therapy helped a lot. But again, it can only go so far. You know, you keep talking about the same things. So the other thing I've tried personally is to see a kinesiologist.
Right.
Or a body alignment specialist or a body talk therapist. There are lots of different kind of energy. I don't know a lot about it. I don't understand it. I don't claim to, but I'm very happy and comfortable to go. And I've had some amazing results over the years through these different interventions of tapping and what I don't even know what the kinesiologist does or did, but I know it's forced me to recognize that there were times in my life that I hadn't dealt with, and these people were able to raise this thing to me that I hadn't considered. So, for example, the one kinesiologist I actually saw in Australia, she was amazing, and she basically said to me, "Your body wants to take me back to when you were 25. What
What
happened when you
happened
were
when you were
25?"
25? Yeah.
I'm like, "What happened?" But of course, that was my first year of being a doctor. I It was horrendous. It was horrendous. I was working 100 hours a week. I was living with my mother. I was back in my family dynamic with my mom and my sister and my dad that I had been out of for 6 years because I studied in another city. I'm now back at home. My mom's dynamic, my sister's dynamic. It's not all bad, but it's little Julia again, the baby in the family back. But now she's a doctor and she's dealing with oodles of death every day. At least 5 patients die a day in the AIDS. It was shocking, and the deaths were painful, and it was just horrible. And then also trying to have a social life. And my mom worried that I wasn't making friends because in our family, making friends is super important. You know,
Yes.
like it's a thing, you know. And my mom would, you know, speak to my sister and say, you know, she's not getting out, she's not making friends. Why don't you invite her places? And so now I'm also trying to have a social life, but actually I'm not really getting enough sleep.
Oh,
And I actually developed an autoimmune condition that year. I got a thyroid problem, which is not very serious, that it's been managed, but it all links together for me. So when you say, and then I actually did meet who was to become my husband and start dating Warren. You know Warren. So it was a very big year when I was 25. And
wow.
I don't think there was any kind of, and I've actually had this conversation with your dad and mom that, and they're like, wow, we didn't know, we didn't realize. And that for me is really interesting because it's not like you come home and talk about work. No one
No.
wants to hear how dreadful your day at work was. So
Mm.
it was a really disconnected time for me that it's never occurred to me. Never occurred to me until this kinesiologist said, your body wants to do this. So I don't know what
Wow.
she did, but so she did a whole lot of things, and I don't know, she's got whatever her stones, and I don't understand it. But I then also took that seriously and went, wow, let me reflect on that a bit. Sure. Actually, let me feel sorry for little Julia, who was quite a state back in the year to 1999, and kind of just heal a bit from that without, I didn't think I needed to, but actually I did. So that's just an example.
Amazing that that was reflecting on it, such a sort of inflection point in your life. But I mean, having been so busy and have dealt with so many things from your social life to your family life to your work life, you 100% wouldn't have had the time or even inclination at that point to have reflected on, whoa, this is an incredibly chaotic period that I'm navigating through. Let me give myself some self-love and realize that actually what I'm going through, even though to other people it might not seem like much, it is a lot. It is a lot. It's amazing actually the whole kinesiology and even the Eastern medicine, the approach that people have from looking inwards and unblocking energies either through reflexology, like you mentioned, acupuncture, all these other means of unblocking the meridians or chakras. Again, I wouldn't be able to explain the details of all of it, but I definitely think that there's some value in approaching it with an open mind. And if it resonates with you and you can think about it and it sits well, then 100% that's a really good method for approaching whatever it is that you're going through, because this stuff does need to have some way to release at some point in time. You can't
Mm,
just bottle it all in and just wait to either have a mental breakdown or lash out at someone. It's got to have some way of getting
exactly.
out of the body. And
Yeah.
at the moment, you mentioned you don't really take all too much time for meditation, but it does sound like there's a lot on your plate as we currently speak. I know you're a lot more
Mm.
hardened and capable nowadays than what 25-year-old you might have been. But
Yes.
what do you do nowadays to sort of reflect and get back in touch with yourself?
So I use an app called Insight Timer. I don't know if you've come across it. It's a really cool
No.
app. You can you can find guided meditations and music and just whatever you're looking for in terms of improving your insight. And there are courses you can take. So I've got that app on my phone and I can do a guided meditation. So sometimes, like, I'm less good on weekends, but just before bedtime, I'll do a kind of a 10, 15, 20 minute bedtime meditation that's guided, which makes it much easier for me because to sit there and calm my own thoughts is very hard. I've got a brain that works over time.
Yeah.
So that's one thing I do. One thing that's really playing like just keeps coming back is I need to write. I need to
Yep.
write. And I just don't. And I've keep promising myself I'm going to, and I don't know why. And I think it's about not creating the time. And everyone says, oh, you should get up early in the morning. And I think one should probably get up early in the
One
morning.
should. Yes.
But I also know the more you use the word should, the more likely you are to have a small mental breakdown because you put too much pressure on yourself. But I do think that is when I have had periods of writing. And when I say writing, I mean could be journaling, could be just writing about my patients. I think I know that for me is a good way of distilling and quietening down my thoughts and really starting to reflect on the things that actually matter out of the situations, the stuff that if 25-year-old Julia was journaling would have would have come out then instead of like 25 years later.
Yeah.
So I think that writing or journaling of some description would really make a difference. Again, it's a work in progress.
Yeah.
That I think I'm doing well with the insight timer and the guided meditations. And in the last 2 years, I've gone on a 5-day silent retreat to a beautiful place called Damagiri. It is a very spiritual mountain in the Drakensberg, KZN. Very simple, comfortable, lovely rooms, nourishing vegetarian food, just so good, the food. And 5 days of silence. And it was guided so that we had two facilitators. So they would do some teaching and they would do yoga with us and breathing and breath work. That's another big thing that I'm not into yet, but during this last one I did in June last year, that breath work was amazing, how it can be so helpful. So yeah, those two retreats that I've done, and I think 5 days a year is good. I don't know if I'm going to be doing one this year, but I think just really taking that time out, no phone, no contact with the outside world, no distraction, just kind of processing and just looking at your navel. It's a gift to yourself, really. Um, yeah,
Yeah.
so those are the kinds of things I've been doing, and definitely an evolution.
Yep. Some form of progression. And actually the thought just occurred to me now. 25-year-old Julia, her network might not have been as established and supportive as what you currently have. And you mentioned as well that a lot of the families that have got really good support networks in place, you don't necessarily give as much support and attention to as those that don't have those support networks in place. Would you
Mm.
maybe be able to speak to the importance of having a good support network around you, people that build you up and are able to, yeah, catch you at times when you might be feeling a little bit down on yourself or overwhelmed or stressed out?
Yeah. So, I mean, look, you can't underestimate the importance of close people, having people that are close, and you don't need many. Um, you really don't. I think it is just having a couple of people that you can really depend on. But friendship takes time and it takes energy and investment, and it is so worth investing in some people and making those decisions and listening to your instincts. And I think when we're young, there's so much external pressure. I think there's something beautiful about being 50 and just not really caring anymore and losing some of the dead weight along the way. I've had a lot of what did my sister used to call them, but quite needy people, that, because I was a fixer. But, in the old days, I was very much trying to fix other people, and that's just such a arrogant framework. It didn't feel arrogant at the time, but retrospect is a wonderful thing.
Yeah.
And just sort of bowing to the pressures of what's fashionable and who was cool, and making sure that you were seen to be doing the right things. A lot of that has fallen away now for me, which is very liberating. Um, but back then it is quite stressful trying to make sure that you are making friends and that you are, fitting in somewhere. But I think all of that, once you kind of distill it down and you find out the people that are really worth investing in, and then you phone those people or you WhatsApp them regularly. And you don't have to do it every day. It can be just friends that are, you know, they're your friends that are just there for you and you're there for them in the same way. But I think that's the key, is you've got to pitch up for each other and checking in on people when they're quiet. And it is a real investment, and that open and honesty, and just choosing who you're going to share your life with, and making sure that you do it and you do it well. And when somebody is not serving you, when a relationship is not serving you, is to let it go.
Mm.
And I think that's quite hard to do. And for me, it was very hard to do, being the fixer that, there. And even yeah, I think in the last few years, my friendship group has probably got a bit smaller
Yeah.
as one gets rid of people that are actually, they drain you. They don't necessarily bring too much, and I end up sort of hanging around with them because maybe I feel sorry for them, or because I just don't know how to be rude, and I don't want to be rude because I'm actually quite a nice person. So it's kind of just really coming back to basics and saying, who do I actually want in my life, and how do I make those relationships work and keep them safe? And obviously that comes with family as well. I'm very lucky to have a sister who I'm extremely close to. Not everybody has that. But again, that's been a long time of work that my sister and I have put the effort in. And she's great because she also phones and we go in contact all the time. Um, but that's what makes the difference. If somebody actually cares enough to keep in contact and make sure that you are connecting, um, not necessarily chit-chatting regularly, but connecting in a meaningful way.
And I think actually, I can only speak from my own experience, but sometimes a lot of the chit-chatting does tend to deter me away from a lot of the friendships that I had. Not in the sense that I no longer value them. It's just I very much value meaningful connection, and when there's a give, there's a take, and you're there to support one another. Surrounding yourself with people that raise your energy, like you said, instead of
Mm.
depleting your energy. You've only got a fixed amount each day that you can operate with. So surrounding yourself with people that build you up instead of bringing you down, and talking to the meaningful relationships you've formed, particularly now that you're of an age where you've had lots of lived experience and lots of wisdom. I think coming back to being your most authentic self, not trying to
Mm.
impress people or forming friendships for the social status that it might provide or the opportunities that it might provide, just being authentic to who you are. Actually, I like to think of humans as some form of electromagnetic field. We attract what our intentions are and the way that we put ourselves out into the world. And if you are acting authentic to who you are with good intentions and kindness and curiosity and open-mindedness, a lot of the things that you touched on, those sort of really, really aligned people will tend to gravitate towards you, and those support networks will form. You've obviously got to put in the work for yourself,
Mm.
because that's the whole point of being authentic to yourself. You've got to find out who that is and who you're wanting to be. But when you do embody that and you live those values and you act in accordance with that authentic version of yourself, people that are on that same wavelength and that do build up your energy tend to gravitate towards you.
Yeah, I agree. I think and having the maturity to look at yourself and go, well, why is this not working? Why, is it me? Is it them? Is it an us thing? Why, w- should I pursue this, and not being kind of lazy about that, and discarding friendships or relationships too soon. But I think having the ability to really reflect on it and to see that maybe this is a me problem, as opposed to a you problem. And I think the other thing is I've got some really wonderful friends who will call me out basically when I'm behaving in a way that perhaps I shouldn't. And luckily that doesn't happen often. But if I've got a situation and I chat to someone about it and they say to me, Jules, can you hear yourself? You kind of, why are you looking at it this from this point of view, or really challenge you? I think a lot of us don't want to be challenged because that's quite threatening and confronting. But actually, those are the gems. Those are the real relationships where people kind of look at you, what you're doing and the path that you're going down, and can actually say something about it safely
Yeah.
because you know that it's coming from the best place. Um, that it's just the love for you and wanting to see the best for you and being open to that. And it is quite scary, to feel like people can criticize you, but that is relationship, is having someone that can say to you, hey, hang on, what were you thinking?
And I think with that as well is, yeah, just to not take it personally, to actually think about if it's someone that you really value and you cherish the friendship, if they are not necessarily criticizing, but offering constructive feedback, or however they might phrase it. Sometimes it's not in a constructive way, but to actually think about what's being said and not just discard it, because there's definitely some value in that. And to learn that, to me, that's the most valuable thing about a really good friendship, where people can confront and say, hey, that what you just said or what you just did is not in accordance with who you are, what's going on. It's
Yeah,
not an insult. It's actually an opportunity to reflect and to think, actually, no, that wasn't what I was meaning to say or what I was meaning to do. And thank you for calling me out on it.
yeah.
Mm.
Thank you for pointing that out.
Thank
I'll
you.
do better next time.
I suppose I wanted to quickly touch on one last thing. I know you had a transition in a very late stage in your life where you were in this very loving and stable relationship. You had two kids from the outskirts. That's what the world saw. And you took a very brave and courageous decision to have an amicable split and go your separate ways. And you managed to find the partner that you're now with, Tracy. That would
Mhm.
have come with all of its own backlash and societal noise and all types of different opinions coming your way. How did you navigate that, and where did you find the courage and the bravery to make such a big transition?
It was very brave when I look back. So my marriage to my children's father was a pretty good one. We didn't have a lot of problems, but at the same time, we both had a lot of childhood baggage, I would say, that we didn't deal with. And we just didn't deal with it well at all. And we were actually better with our kids. And it was when we had our kids that it really kind of, I think things became exaggerated, because we were both trying to be these good parents, and then we were kind of judging each other, quite harshly, and didn't really know how to communicate about what we were feeling because we were both quite stoic in our personality types. And it just sort of progressively got a bit more miserable, and I was miserable. And I found having small children exceptionally difficult. I won't say it was particularly because of mine, but it was hard. It was hard days, and I remember kind of just sure wishing time away, and I was miserable, and eventually you just realize that you just can't be this miserable. And I remember having terrible sinus, hay fever, and I'd never really been a sufferer of hay fever before, but it started, and I eventually I went to a homeopath, and he said, "What has happened to you?" And I'm like, "What do you mean? I'm just here for my sinuses." And he's like, "No, you've lost all your confidence. It was so weird. He was weird, but it was really confronting. And he went for a whole emotional approach to my sinus. And that was kind of, wow, okay. And that really probably started me on a path of thinking about, like, how do I fix this? And it was years of trying to work it out. And eventually Warren and I did go for some therapy. But I think by then I decided that I was out. I was done. This wasn't for me. Um, and I often wonder if we went for therapy earlier, if we wouldn't still be together. But anyway, long story short. And then I was working with Tracy, and we were spending more and more time together. We were both single and just had all this time. And she was really good to my kids, and they adored her. And I just kind of felt myself falling in love with her. So, having never thought that I was gay at all, it never occurred to me. It really just never crossed my mind until then. And so, yes, I fell in love with Tracy, and we got together and we got married, and we're still together. And yeah, I think it just some things you just don't really have a choice about, you know. It just was. And so I think that the hard part was really the divorce and managing that sense of failure, and trying to have a relationship with someone that you're still parenting with, but not. And then, the new relationship was actually the easy part. And then having to tell people, my mom and my sister they were both quite, yeah, the way our family deals with trauma is you just announce it.
You just drop that bomb.
Just drop that bomb. And my mom kind of introduced everyone. And have you met Julia's partner, Tracy, her romantic partner, Tracy? And they literally, and whoever my mother hadn't told, my sister told the other half. And this is a terrible story. But my dad passed away on my birthday in 2012. So Tracy and I got together in February 2012, and in March 2012, my dad was now in ICU and he was dying. And it was my birthday, and I've always made a big fuss about my birthday. So my friends tend to phone me from all over to wish me. And I just thought, well, it's now or never. And I took the leap. And as they asked me, oh, how are you? Oh, no, not so well. Actually, my dad is in ICU and he looks like it's his last hours. And oh, I'm sorry, sorry. But not all is bad. I've actually met and fallen in love with a wonderful woman called Tracy. And they was like, oh, okay. So you're gay now, okay. But because it was in the conversation about my poor dying father, and then it was out, and it just didn't matter. And I realized it was so much simpler than I thought it was going to be. And I think because I was older, Patrick, I think if you're a teenager trapped in the wrong body, and I kind of have huge empathy for people who struggle with their sexuality and struggle with their religion and their culture and what that will say about their sexuality when they're young. That must be enormously stressful. I was blissfully unaware back then. So I think, coming out at 38 or 37, no one really cares. Everyone just wants you to be happy, at the
Yeah.
end of the day. And that was my experience of it, which I think is quite different to a young teen who is trying to establish themselves in the world, in their school, in their place, and in their body.
Would you have any advice? I know it's not your lived experience, but any sort of words of support or things that you might be able to say to teenagers or young adults that are going through some gender identity crisis?
I don't have any major pearls because, as you say, it's not my lived experience. But I mean, I do work with a lot of teenagers that are ill and they've got their own stuff and identity issues that they're working through. And I just think you can't. I don't think the pursuit of happiness is the beginning and ending of everything. But at the same time, I don't think we can live our full potential and happiness if we are not on our true path, whatever that looks like. So coming back to you use the word authentic self. And, I think, we're moving to a place now which is so much nicer than the childhood society that I grew up in, where people are generally a bit more open to not labeling. We still love to label. We're a human being. It's a condition of the human being that we love to label
Yeah.
everybody and everything. But, more and more people are meeting when they're young. They're not, staking their claim. I didn't have to come out as straight when I was a teenager. You shouldn't have to come out as being gay. I think if we just approach it that who you attracted to, who you want to be with, who you want to spend time with, you pursue that, and obviously in a non-creepy way. Um, but you kind of you seek out your friends and the people you want to spend time with that actually bring out the best in you, whatever that looks like. And I think if we can just all start focusing on that and less on kind of the labeling and the identification and um, yeah, and the other thing is to get help. I know, I mean, I don't know in South Africa how many support groups we have, but a friend of mine in Australia, her daughter attends an LGBTQI support group. And, it's not sort of support, but it's actually quite fun. And it's about hanging around with people that are also going through the same stuff and just having that openness of seeking out the support. Because if you don't have it within your own family, which a lot of people won't, and you don't have it in your own school and in your immediate friendship group, go online, find your people, find your tribe, get the help that you need because it is out there. You just have to look for it and be open enough to seek the help that you're needing to get things clear in your own head.
Yep. Yep. And community, like you said, it is such a big part of that. Surrounding yourself with people that are able to support you from maybe their own lived experience. It's so important because yeah, even though we are living in a day and age where people are a lot more accepting of it, no one can completely and holistically encapsulate what it is that you're experiencing or transitioning through. So it is so, so important to find a community of people that can be there to support and somewhat understand and walk that journey with you. Maybe the last question, your work with palliative care, how has it shaped your view on death and mortality? How do you view death now as a result of the work that you do?
So I think from a family point of view, we've always had quite a healthy respect for death and not been afraid of it. We lost our grandparents quite young, and from early on, I think I wanted to see the dead person. I needed to
Confirm.
confirm that it was in fact true and they were gone. So I think we've had an openness about talking about death and dying from young. So that did sort of set me up quite well to not be freaked out by the whole concept. I think, just this also the other realization is that you don't get out alive, right? It happens to everybody.
Yeah.
And hopefully it happens as late as possible with the most meaning and joy before then. But however it's going to happen, it is still going to happen. And not talking about it doesn't make it not happen. And not thinking about it doesn't make it not happen. And on the converse, is talking about death and dying doesn't make it happen any sooner.
Yeah.
So I just feel that I want my dying to be, I can't control when it's going to happen. And I'm not a huge fan of euthanasia. I'm not, and that's a whole nother conversation. I'm not completely anti, I'm not on any kind of fanatic path there. I just don't think it's necessary. I think that waiting for the time of your death, as long as it's comfortable and well controlled, is fine. And I think with good palliative care, we can mostly achieve that. Not always, but mostly we can get that where your pain is managed. You are surrounded by people that you want to be surrounded by in a place that you choose to be. So that's the ideal. So I would love to have some kind of control over how my end happens by ensuring that I have a good palliative care person by my side that can give me the good drugs, that can have the good conversations. So that's one of my big things is like, don't put me in hospital where the doctors just get to decide everything. I want to have some control. And I think that if we can talk to our families about our wishes early on, like what matters to you, my kids do know a lot of the stuff about me, what matters. They know that I'm an organ donor. They know that, I wouldn't want to be kept alive on a ventilator if there was no real hope of recovery. So I think having those conversations doesn't make your death more imminent.
No.
And just being a bit more prepared and sharing your ideas and understanding what it is, because that also gives your family the sense of relief, right? If I know that my mom planned the whole thing. She had a terminal diagnosis, so this is your granny.
Yep.
And she knew for a long time that she was going to die of this terminal illness. And so she had lots of time to plan. So we even had gone down, she picked who was going to speak at the funeral, the flowers we were going to have, the hymns we would sing. She really we were able to honor her wishes completely in her death, which it was such a lovely experience for us as her kids to know that we did what she wanted. We honored her right to the very, very end. And I think that's probably what's come out of my palliative care career is really realizing that that's possible is, it can actually be a good death. It can be less painful than it needs to be. Because, we always say we can't make things better, but I know, but a poor death, poorly managed, poor communication can make things a lot worse.
Yeah.
The pain of losing someone doesn't get better, but losing them badly, the memories that stick with you, the way people spoke to you, not being able to honor someone's wishes, that's what sticks with you. And that can make a loss much worse.
Thank you for listening to that episode with Julia, exploring and unpacking palliative care, patient-centered approaches to healthcare, as well as the importance of just listening and being there to empathize with someone and to show compassion rather than to show sympathy and be disconnected with someone else's experience. The topic of death is something that we shy away from quite often because it's not a very pleasant topic to talk about. It's actually quite melancholy in nature. However, I do believe it is an important thing to explore and understand someone else's perspective surrounding it. As Julie had pointed out with my grandmother, it was really something quite beautiful to know the way she wanted her funeral to operate, the songs she wanted sung, and the people she wanted present. I think to have an appreciation and a respect for death is important, not to dwell on death and live in fear of death, but to embrace the uncertainty that life has and to know that death can come for anyone at any time. So why not be the best person that you can be in this moment in time and embrace the uncertainty? Thank you, and have a great day.